Hello, it's Dr. David Green, founder and CEO of R3 Stem Cell International. Today we're discussing stem cell therapy for cerebral palsy in the Philippines. So I'm going to go through how common CP is, some of the causes, what traditional treatments entail, and then we'll talk about stem cell therapy, what the research shows, and what our program includes. So how common is CP? Well, if you look at the US, there's around 10,000 babies born each year with CP. In the Philippines, it's actually 1 to 2% of the entire population has CP. So that's about 1 to 2 million individuals. What are the risks? Well, home birth, birth asphyxia, being premature, having low birth weight, or an intrauterine infection. Boys are diagnosed more often with CP than girls. CP is the most commonly diagnosed childhood motor disability in the entire world, and over half of children with CP can walk independently. What are the causes? Well, it includes brain damage due to lack of oxygen, and that can happen either before birth, during birth, within a month after birth, or during the first years of a child's life while the brain is still developing. Congenital CP occurs before or during birth, about 80% of cases. The other 20% is called acquired CP, which is when brain damage occurs more than 28 days after birth, and this is usually due to an infection like meningitis or head trauma. So what are the different types? There's 4 different types. 80% of the time it's called spastic CP, which is where increased muscle tone is present. Dyskinetic CP includes uncontrollable movements. Ataxic CP includes problems with balance and coordination. And then the 4th type is called mixed CP, which is a combination. Traditional treatments, one could be medications for the muscle spasms, and also children with CP often have seizures. So that could be baclofen, anticonvulsants, Botox, stool softeners, and sleep aids. Surgery could be for releasing contractures, those are common. Surgery to reduce spasticity and to increase flexibility. When you look at alternative CP therapies, there's energy therapy, movement therapy, mind and body techniques, aquatherapy in the water can be very helpful, and then stem cell therapy. So stem cell therapy began to get extremely popular as more research studies have come out showing its benefits. It's one of the more common reasons we perform stem cell therapy at our centers around the world. Also, since we found out that doing cross-matching, HLA typing is unnecessary, the popularity has increased tremendously. We do know that stem cell counts are very important in treatment, and the procedures with stem cells include either autologous, which includes the patient's own bone marrow or fat, or allogeneic, which includes umbilical cord stem cells, amniotic fluid stem cells, and allogeneic with umbilical cord mesenchymal stem cells has been the most common. That's what we use. All right, so let's look at some stem cell research. So here's a review article that was published a few years back, and they looked at 5 studies. That's called a meta-analysis. When you look at multiple studies and pool the results. Now, what they showed is a statistically significant intervention effect from stem cells on what's called gross motor skills. And umbilical cord blood was actually the most effective. There were rare side effects. They did not use immunosuppression in any of these studies. Now, what exactly is gross motor skills? Well, so I put that right here. It can include improvements in balance, coordination, body awareness, physical strength, and reaction time. So, for instance, if someone's going to fall, they react better and it doesn't happen. All right, so here's another study. This was a randomized, placebo-controlled trial of human umbilical cord blood mesenchymal stem cells for CP. This included 54 patients, half of which received the stem cell therapy, other half didn't. The infusion group comprised, half the patients who got 4 infusions of a total of 200 million stem cells. Okay, so the results of the study indicated once again that umbilical cord stem cells was safe and effective in improving gross motor skills and comprehensive functions. All right, so it showed a lot of the same of what the other studies showed. Here's a study from quite a while ago. 8 CP children treated with umbilical cord stem cells. None of the children had any immune reaction. 8 out of 10 showed some improvements in mobility and or cognitive function, and 6 rated improved in muscle tone, hip movement, leg movement, rolling to the side, balancing, it was sitting or standing. So I do want to note that our centers don't use embryonic stem cells. Those are the ones that come from aborted fetuses. Induced pluripotent stem cells don't come from aborted fetuses, but those have problems as well. Neither of these, embryonic or induced pluripotent stem cells, are ready for prime time. They're not ready for clinical use. If anyone suggests treatment with those, you should definitely run away. So when you look at our treatment program, our results have been very similar to what has been shown in the research studies, with improvements in gross motor skills and comprehensive abilities. So we have really expert doctors. Each patient and their family gets a dedicated patient concierge representative. We use safe biologics with very high stem cell counts. We have a convenient location right in Manila. And what we offer is the most cost-effective program in the world. We're in 8 countries now. We do many procedures every month, and we pass those savings along from our, buying leverage to our patients. So in the Philippines, biologic culturing is allowed. That's called expansion. So our lab in the United States is accredited. We have a pristine safety record. We use those same standards internationally. Our quality assurance standards are actually more involved than the FDA. When we culture, we keep those cells to the 5th generation or less, which means they're very potent and active. We often don't use preservative, which gives us over a 95% viability of the cells. And when we're dealing with patients with CP, we have options from 50 million cells up to 200 million stem cells. Our location is close to the airport. We will provide transportation to patients and their families from the airport to the hotel, clinic, and back. And we can also help provide any other travel logistics assistance. So when you look at our program, it is really cost effective, it's very clinically effective, and it's very safe. And over 17,000 procedures in the last decade, we've never had a significant adverse event. The side effects are very minor to moderate. Might have some nausea, vomiting, it's all temporary, some chills, low-grade fever, really things that resolve within about 2 days. So call us today to set up your free consultation on the phone, which would be the U.S. prefix of +1 888-988-0515. And please visit us online at r3stemcell.com/Philippines. As you can see, we've won a lot of awards over the last few years. We are the world's leader in regenerative therapies, and we would love to help your child. Thank you so much for watching.